Thank you for joining us today live for a Zoom call, or if you're watching this recording later, thanks for tuning in. If this is your first time joining, this is just a series of talks we've had and put together through a collaboration between the UC Davis Mind Institute as well as our School of Medicine with its newest student interest group that's called Developing Minds. This is the last talk of our 4-part series at this time, but we really hope to continue this again soon, just to help raise awareness and educate our community about disability advocacy in medicine. Before I introduce Kathy, who will introduce our speakers today, I just kindly ask if you can answer a short survey near the end of this talk. We really appreciate any feedback so we can help incorporate that into our future events and talks. And with that, I'll introduce to Kathy to help see our speakers for today.
Oh, thanks, Rupa. I just want to say this has been a great partnership for Amber and I with all of you as medical students, and it's hard to believe that the first year is just weeks away from being completed. So thank you for this great partnership that we've had. And I am fortunate enough to introduce two of my favorite people who I know are going to be great partners in this talk. The first is Dr. Scott Akins, who is a developmental and behavioral pediatrician at the Mind Institute. He's chief of developmental pediatrics. And I think, in my experience with Scott, that he is a true role model for family-centered care, which is the focus of our talk today. And he is going to spend the next hour with you and my very dear friend, Dave Perez, who is the father of 2 sons, Andrew and Sam. And you're going to learn a lot about his family and life with Sam. And I always like to count Dave as one of my important friends and part of my circle of support. So you will, I think, gather from this that one of the things that families need is not only a partnership with their doctors who are going to help make things happen for their children, but we also build partnerships, families to families, so that our children can have a meaningful and inclusive life. So I turn it over to Dave to introduce us to a little bit about Sam.
Oh, good morning, everybody. Good afternoon. Sorry, it's been a busy morning. So yeah, I'll give you a quick little history on my journey with Sam. Sam is my second child. He was born, as Robert and I were just alluding to a moment ago, May 29th of 1992. And he was, as I indicated, our second child. And so we really were cognizant of developmental milestones and noticed that Sam wasn't hitting those milestones. So at 7 months, we went to the pediatrician and said, something's going on. And the pediatrician was like, yeah, I don't know, maybe, I don't know, cerebral palsy, I don't guess. And it wasn't the most comforting consultation we've ever had with a doctor. And in fact, that pediatrician we wound up firing within about a year of that experience. We started referring to him as Mr. Gelber, not Dr. Gelber. And so, but he mentioned cerebral palsy. So I, of course, 1992, I couldn't go to the internet and look up cerebral palsy. So I went to the phone book and looked up United Cerebral Palsy, called the office, and they said, come on by, we'll have a packet of information for you. And they had got there, the lovely woman at the front desk had this big pile of information for me, all stuffed in an envelope. She said, there's a lot of stuff here, but find a little white card in there that says warm line and call the phone number. So I did, and Kathy is who answered the phone. And that's when my relationship with Kathy began, and our friendship and partnership and collaboration all these years later as we continue to do that kind of thing. Sam's had quite a ride, many health issues. They said he would never walk, he does. He has a syndrome that took years to diagnose. It's called Kabuki. And it's a lot, you can think of it a lot like Downs, in that there's physical characteristics, manifestations, but the range of development, it can be fairly broad. And there's certain consistent medical issues. He's had major GI issues. He's had a bowel resection. He's had heart surgery. We've he's been through the mill and back. And in the course of this journey, one of the things that we have really learned is how to communicate with doctors and how we would like to be communicated to. And before I go any further, I just wanted to share this picture of, that's just taken a couple of years ago at Chavez Park. So that's my older son, Andrew, and the sunglasses, Sam's there in the middle. So I'll give you a little idea of who we are. Yeah, we had at about 6 years old, Sam was really going through a lot, failure to thrive. He was horribly sick. And we find, in doing our research and talking to his doctors, we determined that he potentially had cyclic vomiting syndrome. So, and I'm bringing this up because it's I think a foundation for what we want to talk about a little bit today, which is communication and understanding. And we went to his neurologist, and he said, we need help figuring out why he's so sick. And the neurologist is kind of bouncing around, and we said, well, we think it's cyclic vomiting syndrome. And instead of his neurologist saying, well, why do you think that? The neurologist went on solid minutes for all the reasons why it couldn't be cyclic vomiting syndrome, because it'd have to be this and this and this and this and this. And then we pulled out all of our charting, and we said, well, yeah, that's what he is. And the doctor went, oh, okay. So that communication, right? And just, that beginning of that understanding. So Sam has continued to develop and thrive as we've worked through all of these various issues. And today, even though, it was thought that his disabilities would be degenerative, it's been the opposite. He's really developed and grown. And as I was talking about right before the meeting started, he's out today at one of his volunteer sites. He works with a day program on a daily basis that supports him in doing those things. He walks a couple miles a day. He goes to the gym. He has a very, very active life. He's nonverbal, but he has a communication device. And one of the things that we're going to be talking about is communication, and communicating with not only the individual who has a disability or disabilities, but the family as well. And one of mine and Kathy's favorite quotes from a friend of ours that we gave an award to a number of years ago is, just because I can't speak doesn't mean I don't have something to say. So with that, I'm gonna show you one more picture of Sam, and then, oh, actually, the one more thing that I wanted to share very quickly here. When Sam was 9, it was at the beginning of the Mind Institute. There is the groundbreaking memento, a little shovel and all, because Sam was one of the poster kids, you could say, for the Mind Institute back in 2001. And his brother, who at the time was 13, was one of the panel of speakers at the major fundraising events for the Mind Institute. It was really, really quite a deal. And then lastly, here's a picture of Sam today at one of his big outings back in the before times. And these things, of course, will happen again, but he's very social. So does that, Kathy, does that give you give everyone, I think, a pretty good background of where we're coming from?
Yeah, Dave, that's a great overview, and thank you so much for sharing the pictures and beginning to tell the story. And it's amazing to hear all the progress that he made, and that you've been involved with the Mind Institute, sort of since day one. And when we talked the other day, I kept thinking about how hard you've worked to become, a fantastic parent and patient advocate, and the role that a patient plays. And one of the things that really resonated for me was talking about the importance and making sure that physicians and our young medical students and other providers understand the importance of having Sam involved in care, in any patient in care. And could you talk a little bit more about how, Sam likes to be involved in decision making, how doctors do that well sometimes, maybe how sometimes even how it, doctors in a rush and it takes them a little while to communicate, and how much it means if they can take a little extra time, or maybe do what they can that time, and speak with him more next time, and just some thoughts about that and how that all works.
Yeah, when we talked about this last week, we really talked about the importance of understanding in an appointment that Sam understands what's going on. And again, just because he's nonverbal doesn't mean he doesn't have a lot to share and contribute. And most importantly, that his presence is respected. It is, I mean, we all know this, that it's so easy for someone to walk into a situation with a family who has one member who's disabled, and the professional care provider who's walked into the room begins talking to everyone except the patient, and what a gross mistake that is. But I was thinking about this morning, and the flip side of that, I will tell you that Sam is almost always happy to be underestimated, because if the situation is like, the doctor's like, well, I'd really like to listen to his heart, but okay, Sam, we gotta take the or whatever it might be, and then the care provider's like, oh, no, it's okay, we don't have to, we can work around, like, and Sam's like, yeah, I just want to sit here, you guys do all the work. He is always happy to let you think that he is less capable than he is. And, and we don't necessarily like to let him get away with that. But at the same time, so it's a balancing act, right? It's understanding who he is, it's respecting who he is, but it's working as a collaboration with everybody in the room, and allowing for that to happen. Probably the biggest key is dispensing with assumptions, right? And I have found in my own life that I have much more effective communication when I stop myself from making an assumption and phrase it as a question instead. So it's what's a good example? I'm sure, Scott, you probably have a thought about that, of things that you walk in and you immediately assume because you see a wheelchair. Oh, can we, do you know the way to the chair, so we can put it on the scale and then subtract that, and like, oh, hang on, rather, is it, can you walk? Sam, can you stand up on the scale?
Yeah, that's such a perfect example, because you walk in and maybe you had to come from a bar parking garage and you came in on a conveyed stroller or a wheelchair, but very comfortable ambulating a few steps, or maybe even a lot more than that, but that's just the best way to come in and make sure he's ready for his visit, and being prepared to ask. And it starts at the beginning with everything from with many kids we care for. Is he comfortable getting blood pressures done? Is there a good way to do that? Or distraction that might help, all the way to like you were saying at the beginning of the exam, asking permission to do the exam. Is it okay, Sam, if we hop over on the table, or Sam, can I give you some help getting over to the table, whatever that might be. And then thinking about what part of the exam you do each day, who should be in the room for the exam, continuing to think about that. We talked about also in this context that sometimes what happens is that you would bring Sam to an appointment and he'd have his caregivers or his IHSS worker or respite support or maybe a therapist there, and the role that they can provide in helping share information about the part of the day that you're at work, or some unique aspect of work they're doing with him or therapy they're doing. And can you talk a little, I thought it was great what you were talking about, ensuring that they involve Sam and the parent and the caregivers, and how providers can do that well.
It's as much as Sam is integrated in my life, and as much time as I spend with them, it still doesn't compare with what especially his primary care provider has. I've heard that Eskimos have like 32 different words for snow. Similarly, Sam's lead care provider has at least that many words to describe the various forms of Sam's poop. Right? And so this is a critical thing to know when you have GI issues, and she's not shy about sharing that information. So her input is incredibly valuable in those doctor's appointments. Oh man, I can't think of the last time that Sam and I did a doctor's appointment, just the two of us. I'm always got a support person there. His appointment last week with GI, I brought in 2 care providers, and they, I just sat back and watched the show. They were fantastic, and the doctor, oh my gosh, it was really fantastic. I mean, the doctor immediately engaged because you know, a number of reasons, but, you know, not the least of which, you know, they were a lot closer in age than I was to anybody else in the room. You know, Sam and the care provider and the doctor, that's one age group, and there's me. And yeah, it just, you know, it's just really powerful, you know, what can be communicated in that level of engagement.
Yeah, we were talking about how it can be helpful to sort of go around the room as a provider and say, you know, Mr. Perez, thanks. Is there anything else? And then turn and just simply say, I know you're doing daily feeds to the care provider or daily stool management, and I think you brought some data in for me to look at. Is it okay if we all look at that now? You know, and just sort of having a natural conversation and continuing to check back in with Sam, even if he's not saying much, getting him to laugh or sitting near him. Or are there other things, you know, you ever notice, and maybe you don't, that providers do that help him be more comfortable and help him know that he's engaged? We talked about how last time about how just, you know, sitting right next to him or fist bumping or high five or having some kind of routine or ritual so that, you know, you like you do in any relationship, and how important that is. Or do you notice things that providers do well in that regard? Or
And so a couple things. One, Sam will gesture a lot, and he's got a handful of signs. And I like to say Sam speaks sign language with an accent, right? Because of his CP, he can't do a sign perfectly, right? So, you know, this is camera, right? But, you know, he does that, okay? So, you know, he's got a pretty heavy accent sometimes. So when it's clearly a gesture taking place, you know, taking the time to understand the meaning of that gesture, not just mimicking it, you know, and saying, oh, okay, you raise your hands, I'll raise my hands. No, this is not, you know, parroting. It's, you know, seeking understanding and getting that communication. The other thing is, you know, Scott, you were, you know, talking about you working, like transitioning up to the table, and like I was talking about Sam, you know, we don't want to underestimate Sam. You know, yes, he can get up, yes, he can do these things. Flip side is there are times, you know, when you watch those dynamics, you can see, okay, there's compliance, there's agreement, there's reluctance, and then sometimes there's like a no way deal breaker, right? I am not getting out of this chair today. And so then, and recognizing those different, and then going with those. Yeah, he's a little resistant on the table, but it would really help if he did. And can we make that happen? Yes. No way he's going to get out of the chair today. Okay, let's adapt the exam and the visit today to work with the chair and what we've got there. So, you know, it's that constant process of adapting. You know, going to Sam first, you know, is it okay if I do this? You know, I have this question, you know, do you mind? And normally, and you know, I'd like to think that the family and the care providers are also actively participating in this process, because you know, it's definitely easier and I think better for me to turn to Sam and say, okay, you know, this is appointment time. We're going to be talking about you. Is that okay that we're doing this? So we're talking with the doctor about this right now. You know, and then Sam nods his head and away we go. So, you know, facilitating that level of compliance and agreement and buy-in.
yeah, that's right. I mean, and sometimes things are sort of non-negotiable. You know, if you have a pressure ulcer, we got to get a look at it, something like that. Or you've had a recent seizure and a change, or an eye problem where we just got get a little bit of look, but it doesn't mean that You can't do that in a collaborative way that evolves over the 20 minutes from the beginning of the appointment. That might be our goal. That it's always hard to get an exam with him, and so we've talked about it beforehand. It's going to be really quick. That's all you got to do. Then you're going to take the rest of the day off, that kind of stuff. And generally, his caregivers and parents, you'll know him well, and we'll get through it. There's ways to get through that. I was thinking earlier too about one of the things that you talked about right in the beginning with Kathy, meeting her, and how you didn't have the internet, but you made a call. You called Warmline, and how critical it is to build a team and support and get to know other families so you can start to begin to move through all of the information that's available. Some of the stuff, the good information, the bad information, which doctors you should go to, all of that. You have any comments that you just could share about building out that team and finding, just that process?
Having a list of resources and organizations, both formal and informal, is huge. Sam's had, networks because of, various things that he's been involved in. Years ago, he was in Saddle Pals, right? And so he had a network from Saddle Pals. And when you go and you take him to horseback therapy, you're sitting there for 45 minutes or an hour. And so are other families. And so those conversations naturally evolve, right? So as a provider, knowing what some of these resources are, hey, obviously your child has orthopedic issues. Have you considered therapeutic horseback riding? And then having those recommendations. Here's Saddle Pals or Project Ride, or that kind of thing. And even going beyond that, one of Sam's groups he's been involved with for a long time is a subgroup from Young Life. And he's developed a lot of friendships from there. And again, it gives us the opportunity as parents to spend a little bit of time communicating with each other while our family member is otherwise engaged in some activity or another. So there's, there's just all kinds of events that happen. And then of course, the school system obviously provides a fair amount of those resources as well. But being able to make some recommendations along those lines, so that because otherwise, how many times, Kathy, that you and I have seen families that are just going it alone and just get lost in it. So I'm doing just recently started up with the Sacramento Parks and Recreation has their recreational, what's it called? That was called, Kathy, recreational.
Are you talking about Access Leisure?
Yeah, thank you. And so they've started a parent group. And so, once a month on Zoom, and it's been fantastic. I pour myself a glass of wine, I sit down in front of my computer, and we commiserate for an hour, and we share ideas.
And you find really solutions, right? Sometimes I always think there's so many valuable aspects of that. First of all, that's how we raise all of our children. For Andrew, you did the same thing, right? At a soccer game or a little league game or whatever, and somebody said, don't go to swim class here, go there, and this is the best preschool, and on, and he's not falling asleep, try this. And that's just sort of, how we find our tribe and how we parent in general. And when families that have a child with a neurodevelopmental disorder, that really they need a lot of solutions and sometimes more information and more high quality information when they're isolated, like you were saying before, it's just such a burden to carry, plus with all the worry. And it's just nice to know that other people are finding, working through the same struggles. And Rupa, for you guys that are med students, sometimes I think of it as just a parent who's a couple years ahead of you in the process is almost like being with the MS2. When you're in MS1, they just went through it. It's very near to them, and it's just one step ahead, and you can get there, and you hear about how people just solve some of these things that are so hard for you right now, and your skill building and all that, but it's a lot of skills to build, isn't it? Dave, you really have to build a lot of skills over time, and that information is so helpful.
It never pops. I had call to over the weekend. I received a text from a friend who's like, and going back to the, it always comes back to poop, doesn't it? And it's like, how, what are you doing? How, because our, she's not doing okay. So we brainstormed for half an hour or so and tried a few things. And I've got back-to-back texts the past 2 days going, we hit gold.
So, and I think just for providers too, sometimes it seems overwhelming because you go, I don't know where the best swim class for kids with autism in Roseville is, much, or Galt or whatever else. But if you just gather information and get to learn some resources and find out places like Warmline that you can connect families to, and just start throwing all that information in a Word document when a parent comes in and says that, I found a great swim class, just put it in. And over time, you will really be able to connect people. And it will change. The last year's swim class isn't going to be the same as next year's, and parents will help you stay informed about all of that. And
curate the list. Yeah, that's it. Yeah, he's continually curating that list. Yeah, absolutely.
yeah. So we were also talking about appointments and going to a new doctor, and how, when things say have been going well with GI or neurology for a long period of time and a doctor retires or moves on, or you just have to transition because of insurance or for some other reason, how high stakes those appointments can be and how parents prepare for them. And, you hope it all goes well that day. And we talked a little bit about some, kind of good appointment, bad appointments, for those new information and just having to tell the story again. And I thought you really had some insight into, what that process was like, and how, and people might benefit from that. And I know we've said some of this stuff already, but.
Yeah, and it's, oh my gosh, I mean, filling out those forms, over and over again. But it's technology has really helped with that, and making some recommendations to families to utilize that technology. Asking for whether it's a medical service or a service that's from the state or the county or something like that, where I try to get forms that are editable, and then I keep digital copies so that I can go back in, and that's really saved a lot. But yeah, going into those initial appointments, sometimes there's a good understanding of the doctor has read the notes, right, and taken some time to really do that, and then sought clarification as needed, and just not, I mean, it comes back to exactly what we were saying earlier, Scott, which is just not making those assumptions and not knowing that what the family's situation was that day. Could have been a great day, and it could have been a horrible day, and could have been the same day, coming in with that. But in the end, a lot of times it's the you've gone through, you haven't made assumptions, you've asked good questions, you've gone through the notes, and sometimes it's that one last, is there anything else? Asking that question one more time, and then all of a sudden, that unlocks the door sometimes, right? It's like everything else has been on the surface, and you're dealing with the band-aids. What about with the underlying dynamic? And it's like, and sometimes that's when things really come out. So having allowing for that time, and asking the questions instead of making the assumptions, I think is usually a fast way to get there, because you're not having to, as a family member, as a patient, you're not having to unravel all the assumptions, right? You're just starting right from the, with a blank slate, and going from there. Is that what we talked about the other day? I think so.
It is. And I was just thinking about things like, so let's just go back to the example of the ongoing GI issue. And I read about it in the computer the night before or early in the morning, and I get ready to see the patient. But it's not always accurate, and things have changed since the last visit. And it's just, so you're right, easier to say, hey, I read about these issues. This is what it looked like last month. how have things been going? What's changed? Did what we recommended actually work? All that kind of stuff, and then just start from there instead
And
of.
what are the priorities? What have priorities changed? It's okay. That's I understand he's biting himself. Okay, is that your priority today? Well, actually, no. Priority is his gut, because he's probably biting his hand because his gut hurts.
Yeah.
Right. So, are we going to try and fix this behavior with medication here? Or are we going to try and fix this behavior with where the real issue is?
Yeah. Yeah, that's right. Because if it's just communication and frustration, then we should fix the underlying causes for sure. And so that sort of helps lead to the other thing we were talking about, and how important it is that, so when you have a child with complex medical disorders, or any family member, and you go into the doctor's visit, setting priorities is really critical, because sometimes we ask, we can really overwhelm families, can't we? If we say, hey, I want to get these 4 labs, and it's a difficult blood draw, and maybe when Sam was younger, or maybe even now, he's resistant to that. We also need to get some X-rays that maybe they don't need to be done within the next 6 months, but I'm going to order them right now, and I'll put in 4 consults, and you've got to, call your insurance and do all the things you have to do to make those things happen. And then medications, and it's not uncommon where there's 8, 9, 10, 11 things that we ask you to do after an appointment. And maybe we don't always think about your capacity to manage 8 things right now, and maybe we could split them up. We were talking about, and do some of them down the road. And can you talk about that kind of shared decision making, and how to set priorities, and maybe the role that as a parent, learning to communicate that could we do that next month, doc, kind of stuff, and just how doctors can help you with that, or how you've seen that done well, maybe.
Yeah, no, understanding the nature of the test, going a little bit deeper, because sometimes you can actually answer the question. It's like, well, you know what? Here's all the reasons why we haven't worried about his heart the past couple of years. And an EKG, I mean, sure, but I don't know that we necessarily need to do that because of, or, a breathing, lung capacity, whatever they call those tests, pulmonary. Yeah, pulmonary test, might be helpful information, but guess what? You're never going to get his mouth on one of those things and get him to blow as hard as you want him to. Well, we'll try it, but understand we're probably not going to get any results from it. So engaging in those kinds of conversations, Sam is actually tolerates blood work really, really well, and stunningly well. But I know a lot of families who have family members who don't tolerate blood work really well. So, with Sam, do we want to have to go back a second time a week or 2 later? No, but it's not the end of the world, where for someone else, that could be, their biggest fear. Right. So understanding those dynamics, and so you're going unarmed. And one of the things we shared last week was we just had a request for a big panel with a couple of tests we've never done before. And I didn't get an understanding of what some of those additional tests were. And when we got to the lab, the phlebotomist says, well, we don't normally do this test this way. He should have been fasting, so we're not going to do it. I'm like, okay. And we got back to the doctor, and he's like, oh, no, I wanted it done that way. Well, you know what? Had I known that, it would have gotten done. So, just, and this is, and in that example, I'm talking about a doctor who I love, and we have a great working relationship, but that was just one time where he was in his head and he was really working through some stuff, and he did the orders, and we just didn't have it was much of, my bad as his, that we didn't get that clarification. So yeah, that is just taking the extra minute to communicate the nature and the purpose of the next steps can make all the difference.
This is a good place. I think you were just talking about a doctor you love, and how you clearly have a relationship with providers, and sometimes these relationships last for years and years, and how you build out trust. And I think it's maybe an opportunity to talk about what doctors can do when they don't communicate perfectly, or they make a mistake, or they convince you to do a test, like let's do a sleep study, and you spend a whole night in the hospital, we get no information, and you're there with a, crying, kicking, frustrated kid all night. What are some things doctors can do when they see you in follow-up to, help continue to establish trust and to, can you talk about that communication? We're not always perfect, but a lot of physicians, they're always pulling for you and on your side, and there's ways that people do, communicate and maintain that relationship and building trust. And if you can think about, maybe if there's anything we can share about how providers have helped, earn your trust, some things they might do and maybe some things they don't do that make you worry about if you can trust them or not.
Yeah, it really does come back to those questions, right? It's like, well, we really want to do a sleep study. How do you think he'll do?
Yeah.
Just taking just those how do you think he'll do? Just 6 more words, with a question mark on the end, can make a huge difference in everybody's experience and result and the trust dynamic. Now, just, knowing that, I'm, I'll never be a doctor. But there are some things I know about Sam's medical conditions that are more extensive than some doctors, right? So, I'm a specialist in Sam. And my gosh, I mean, how many families are like that? I mean, you really, when you spout, terminology and, you talk about, Sam's Nissen fundoplication, his pyloroplasty, and his G-tube placement, and we can spout a lot of terms, but it moved 6 degrees to the left and with something that Sam's not involved with. I have no idea what you're talking about, right? But I do specialize in Sam, and recognizing that it's that shared decision making at that point in time when the parent does have, and it's helping that parent build their own confidence. I think probably one of the most valuable things that, what I just said about me being a specialist in Sam, I don't think I'm the one who originally said that to me. I think it was a doctor who somewhere along the line said, you are the most knowledgeable person about your son. That helped instill in me the confidence to continue on this journey and to work with other doctors more effectively. So, helping to build up all the individuals in the shared decision-making process is invaluable because the doctor still is the doctor, right? She is still the specialist. And having that professional acknowledge your expertise with your own family member is invaluable.
Yeah, I was just thinking about it. At some point when you learn, when you're caring for, families of children with medical complexity over a period of time, that you have these bright ideas and you go in the room, but you learn to say, I don't know if this is 5 or 6 words, but you've been doing this a long time. Have you tried this already? How did it go when you did it last time? And sometimes it's important to say, yes, but we know this is more effective in teenagers than in young kids, and here's why. We have better chance now, and or you're trying to reduce toxicity from another medication or what have you. But yeah, I'm assuming it feels a lot better when somebody starts with that. You can tell the story, and then you can have that deeper conversation, and it does help you be more confident, and also help other families as well. I assume, which is another way to be more confident. I think all of that engenders confidence and expertise over time. Are there, right, Amber? Are there any other questions, or could we open up for questions? I want to make sure we have time. I've got to.
No, we definitely, nothing's in the chat yet, but definitely would encourage you if you have questions, if you want to put it in chat, or we're a small enough group. If you wanted to go ahead and unmute and ask Dave a question, that works well too.
And Kathy, if you have other observations or questions, please, I know you had a similar shared experience or other things that that I know that you've worked with Dave for so long, but other questions, please let me know. So
Sorry, I had a question for Dave. Earlier you mentioned that you recently joined a support group, and I'm assuming that was probably virtually. And you also mentioned beforehand that in the early 90s, there wasn't really the internet as powerful as it is now. So I'm just kind of curious, what has your how have social platforms changed parents' access to resources and each other?
Yeah, it's been significant, and it was interesting. The um, the specialist I was alluding to earlier with the tests, he recently really got inspired about Sam's Kabuki and started doing some research and came up with a couple things that I didn't know. Sam has this light blue tint to the whites of his eyes. I'm kind of colorblind, never noticed that. But once you pointed out, I'm like, oh. And I guess that's something that can be indicative of some other syndrome or condition. I don't recall. So he was researching that. And then the follow-up meeting, I'm like, hey, what about the blue tint thing? He's like, oh yeah, no, that's common with Kabuki. I'm like, it is? Well, that's fascinating. So then he said, he goes, but I'm only able to get so far. What other resources do you use? And so I reached out to my other son, Andrew. And I said, hey, doctors looking for other resources, support groups. And Andrew is very, very active in social media. He's in the entertainment industry down in Southern California. So he knows his way. In fact, I was just asking him to explain this TikTok thing to me, Andrew. I don't get it. When I get the link and I can see and I get lost. So he's very good at all that stuff. And he came back with a support group out of Alaska that I had never heard of before. And so I get onto their Facebook page and I find multiple things that I hadn't really thought about before. And I actually have now an ongoing note in my planner to remind me, when I've got a little downtime in the evening, to go and spend a little bit more time. So Tracy, it's interesting you asked that question right now, because that is something that I was very active with for a long time, and it's kind of waned. And I'm just kind of really jumping back into it in a big way, because there's just so much out there right now. And it's like anything, you have to filter through and consider the sources, right? Because there could be a lot of obviously misinformation, but I feel pretty fortunate, like in searching for Kabuki specifically, that there isn't a lot of misinformation. If you search for constipation, then there's gonna be plenty of information out there. Not all of it is worthwhile. So there's those dynamics, but yeah, it's made all the difference in the world. And last point on this, when the doctor said, well, there's probably some syndrome, but they had no idea. So I went to the UC Davis Medical Library and I went to the giant encyclopedia of syndromes, and I started to go one syndrome after the other. I didn't make it out of the A's. Or I went, oh, well, this isn't going to work out. I never would have made it to the K's, for God's sake. So yeah, it's made all the difference.
Reminds me of how we, did genetic diagnosis. We didn't even have chromosomal microarrays 15 years ago. They were just emerging 15 years ago. And that's what we would do. We'd go to a book and you could look up all the symptoms. You'd make a list, and then you'd say, these 3 symptoms, Kabuki, the eye findings, or one of the things you'd start with, and hopefully you'd figure it out. But thank goodness now we don't have to do that. Tracy, some of the other things just around that, orphanet or rare chromo, there's lots of syndromes that, when you look them up, they'll say there's only 100 or 200 cases known so far, and connecting families with other families in those cases is so important, especially if there's a couple of ongoing trials. You can also look at clinicaltrials.gov and see if there are ongoing either treatment or even just characterization trials where we're trying to sort out conditions comorbidities that are important. Like we think about things like Down syndrome now, where we have a clinical practice guideline that tells us to look for thyroid and sleep apnea and celiac disease and what ages to do it and how often to do it. Well, we didn't know that 15 years ago. Parents and other folks informed those guidelines, and now we can really improve outcomes dramatically by managing, like Dave was saying before, all those comorbid health problems that sometimes end up presenting as behavior problems for us, and we'll get ahead of them before they even happen. And for many of the really rare disorders, there are parent groups that are very connected, and there'll only be a couple of centers or maybe even one or two doctors that are specializing in doing research and starting to phenotype those syndromes, and having that information come back to you if you're not at one of those centers just really helps you care for families. And families will come in and say, the other whatever kabuki families, the other Pitt family said to do this, and I go, oh, okay. And then you've got to kind of work through, because there won't be a randomized controlled trial that tells you if that's what you're going to try is going to work or not. But you've got a clinical problem, and you work through that with families. And I'm sure that's come up too, Dave, shared decision making around some treatments that are maybe either an alternative treatment or something that you heard might work, and you want to talk with a provider about that. I assume that it's similar to everything else we've talked about, how important it is for them to listen to you and kind of give advice. Has that ever kind of thing come up, some alternative treatments or anything from acupuncture to, I guess horseback riding initially was, that was an emerging treatment. And can you give advice about how providers can help support you when you're considering things that are maybe a little beyond? Yeah.
Yeah, it's really a collaboration. My little dog has decided that now is the time she needs our attention. Get on your bed. She never
It's
does
not
that.
a 2020 Zoom meeting until you talk on mute or have an animal join. So that's all right, man.
She have had too many Zoom meetings today. I'm sorry, what was the question?
The complementary alternative stuff and shared decision
right.
and how, when you don't have, what I was really thinking about is maybe, especially early on, when you have a problem that we're not fixing with traditional approaches, and how it goes on, and how, you hear about other treatments that might be available and want to talk about them with a provider you trust.
Yeah, and it really is a collaboration, and keep in mind that there is a team that exists. One of the things, when, again, going back to poop, go back to that a lot. A year and a half or so ago, maybe 2 years ago, we were really working on this with Sam, and we had, and I finally went, you know what? It's been 15 years since he had his bowel resection. I'm going back to that surgeon who I've kind of stayed in touch with all these years. It was just the one, but obviously a critical moment in time. And I'm like, hey, and now she's like the head of pediatric GI surgery for Sutter. And I said, could we do a consult? And she said, yeah, sure. Send me back, let my office know. So I contacted the office, and they're like, okay, and the date of birth, and 5/29/82, and he needs a long pause because it's pediatric. He's like, and so the scheduler went into the doctor after that call and said, he said he wants a consult, but it's 28 years old. The doctor's like, fine, yes, I told him to do it, let him come in. And she's like, well, has anybody taken an x-ray of his gut? And I'm like, no. She's like, well, let's start there, shall we? Let's see if he's still. And so we did, and she's like, it's clear. So, let's move on from here. So it's that, it's bringing those alternative ideas, but then, expanding on it and saying, and not just, assuming that, good, bad, and different. Obviously something potentially harmful, that needs to be communicated. And, I'm not, like vaccines, right? And I know that, doctors struggle sometimes with patients and families that are resistant to some things, to care that is truly the best thing for them. And so that's, I don't have a good answer for you on that one. I work around that. So, I just tried it because it is, it's a two-way street, and it is incumbent upon us as patients and family members to be cognizant of working collaboratively back the other way as well.
All right. Thank you, Dave. Any other questions?
Dave, could you just talk a little bit about the role as a dad in the advocacy for healthcare? Because traditionally, oftentimes physicians will see the mom, and the mom is the voice of the family about the child. And if they're really lucky, sometimes both parents go together. But maybe the impact of being a dad on this advocacy role would be helpful.
Yeah, it's been a really mixed experience. I mean, I've been pretty much, well, I have been, Sam's only parent that's supporting him medically now for most of a decade. And it wasn't always the case. And, yeah, absolutely. There's even early on, there were assumptions that mom knew better. And, and sometimes mom did. But more times than not, back in the early days, I was fortunate that my wife at the time, Sam's mom, was a good collaborator for a long time, and so we would decide our roles going into an appointment, right? Good cop, bad cop, good cop, good cop, bad cop, bad cop. We'd get all that going in advance, but and then sometimes it worked the other way as well. I mean, we had an incident when Sam was being admitted to the hospital one time where we encountered one of his doctors, I should say his mom did, and the doctor got angry with her and discounted, and I walked in the middle of that and let him have it, right? And that was, so in that point, the only thing he was going to understand was another man, coming in and communicating that. So that's unique to that situation. And to the flip side of your point, Kathy, whereas sometimes a female family member can be discounted. I've seen that with the care providers too. They're, whatever the bias is, they're too young, they have an accent, whatever it might be, and an assumption is made about their expertise just on that, and that's a problem. And then sometimes I get discounted too because I'm just the dad. I got a job, so what do I know?
Well, you're the expert in Sam. We've already established that. That's right. I think we're close to time. Any other questions for Amber?
No, and there's no questions in the chat.
Dave, I just had a question. So I feel like, with COVID, and I know as a family member, I understand like sometimes there's been like limitations with access just given the pandemic. Like, do you feel like with Sam's appointments, it's had to be through telemedicine? If that's kind of changed the dynamic, or you feel like not all concerns are addressed during that time, or have you been able to go in person for appointments? Like, how has that been just transitioning this past year?
It has been eerily consistently inconsistent. So we've had in-person appointments that have been fantastic. We've had in-person appointments that have not gone well. And we've had telemedicine that's been fantastic and ones that have not gone well. It isn't the nature of the venue most of the time. It is the nature of the doctors behind by an hour. Well, and any of the things that can affect an appointment, whether it's virtual or in person, has still continued to be more of the factor. With that said, I don't want the virtual option to ever go away, because there have been absolutely a lot of excellent virtual appointments that have saved an immense amount of time. I mean, just an hour of driving, parking garages, in and out. Oh my gosh. I mean, and then I lose an afternoon versus 45 minutes. It's fantastic. We had a UC Davis medical physical therapist. He was a doctor. And we did the appointment. We did a physical therapy appointment virtually, and it was fantastic. He set up his camera so he could show you all the ways to move, and then he sent me a link. This thing was wonderful with all of these great videos, and but were only videos for the specific stretches and exercises that he wanted Sam to do. It was all laid out beautifully, and that resource now, instead of a handout that I got in the in-person appointment, I had this. Sophie, come back here. Come here. Here's my troublemaker. So yeah, no, the virtual appointment was just absolutely fantastic. So yeah, I mean, it cuts both ways, absolutely, and just a matter of what's going to work at that point in time. Obviously, there's some orthopedics that needs to be in person. Fitting is orthotics, got to be in person, right?
But Dave, we were talking about the other day on those months, those tough months where you might have to, with therapy appointments included, go to 8 or 9 or 10 appointments. That's a lot of half days to give up if you're working and making a living and taking care of your family. And it also, it can take a really long time, especially when you're trying to find the few parking spots that are available for your van with a lift or whatever else. So yeah, that's a great question, Rupa. And we've seen so many positive changes, and like those videos are a perfect example. Almost all of his therapy is not going to be that 30 minutes a week. It's going to be your daily work, and so knowing that that's done as well as possible is so critical. But
the UC Davis Mind Institute was founded in 1998 with a promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.